Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. Today's another good day in terms of cases. We have one new case today that has been reported. Dr. Strang will have details, but I want to say thank you to all of you who've been working hard to follow the protocols and help flatten the curve. We haven't had a lot of good news in this province in the last few months, but when I wake up and see the low numbers and feel the level of relief and gratitude, knowing what all of you have been doing to help keep Nova Scotians safe. Well, we have said all along, we are in this together, and you have proven that every day. So I want to say thank you for the work that you've been doing, and I know the work that you'll continue to do to follow the public health protocols. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Today we are reporting one new case of COVID-19, which brings our total number of confirmed cases to 1,058. The case is in Eastern Zone, and there's somebody who was exposure was as part of their travel outside of the province. Unfortunately, this individual followed public health protocol and was in self-isolation from the time they returned to the province, and so had minimal exposure at the time they may have been infectious. As I reported yesterday, we have one long-term care home with active cases of COVID-19, which is Northwood, and we're now down to 3 residents and 2 staff who have active cases, so we can continue to make progress at Northwood as well. Our QE2 lab continues to work around the clock, and yesterday they processed 639 tests. We currently have 3 individuals in hospital. One of those is in ICU, individuals with COVID-19. We now have 993 people who have a COVID-19 infection but have now been considered recovered. And we've had 43,340 Nova Scotians who have been tested and received negative results. As I said yesterday, the Nova Scotia Health Authority started offering Nova Scotians the option of having a negative test result sent to them by email. And I was updated earlier today, and that a number of people have already taken advantage of this and signed up for that option. We know that people are anxious to get their test results, so an email is a good way to get it as quickly as possible. But regardless, even if you choose to still have your result phoned to you, you'll get it within generally 48 to 72 hours. And just a reminder that anybody with a positive result will always receive a phone call and further directions from public health. I'm hearing lots of good things, and then sort of seeing the protocols that are coming in for reopening and recovery. That's certainly a lot of good work is happening, and I know lots of Nova Scotians are looking forward to Friday to potentially enjoy a meal or just simply an evening outside of their home. But I want to remind people that make sure they have appropriate expectations of that. Your experience will be quite a bit different, whether you're going to a restaurant, whether you're going to a hair salon, whether you continue to go to shopping. That your experience will look different. Certainly in restaurants, we know that you can expect tables will be further apart so they can maintain that 6-foot social distancing, and there's other public health measures that support better hand washing, controlling how people move around in a restaurant or a bar space, and limitations on the type of activities that can happen in terms of entertainment and dancing. One thing I want to make clear is that certainly people have to understand that the physical distancing requirements and the rules around household bubbles and family household bubbles haven't changed, and they pertain to restaurants and bars like everywhere else. So while people may be at tables up to groups of 10, and then unless they can be separated by 6 feet or while they're at that single table, which is not likely, they have to be people from the same household or household bubble. We're not yet ready to have people from multiple different households come together, sit at a single table in a restaurant. So if you're making plans to go out, you have to make sure that it's done with people, if you're going to sit at the same table, within your household or within your household bubble. You could certainly go with other people and sit at different tables and say hello to each other from 6 feet apart. But who you sit with at the single table, it needs to be within your household or your household bubble. So I think, I want to make sure people understand that, because there's certainly been some questions about that and perhaps a misunderstanding on this. So planning who you go out with and how you go out needs to be more thoughtful, and is a key part of our moving forward and our living with COVID. When you're going out for other things, whether it's other recreation or cultural opportunities, whether you're just going out for shopping, it's important you think about who you're going with, and where the setting that you're going to be meeting at, and what particular rules might be associated around that specific setting. That it's important that you understand that as you go out, there's going to be lots of things that are going to be helping you maintain a social distance, helping you wash your hands, and we really ask Nova Scotians to follow those directions. We're worked very hard with our business partners, with our community-based partners, all of whom are creating environments that will support the necessary public health requirements. But at the end of the day, there's an obligation and a need for all Nova Scotians to participate and follow those public health requirements that are being put in place in all our kind of public spaces and retail and business places. And one of the critical things is that people need to understand that if you're not feeling well, then that is not the time to go out. You may have COVID-19, and if you meet any of the symptoms, or if you're not sure, do the 811 online assessment. But if you're not feeling well, it's critically important that you not go out and potentially expose others to COVID-19. A last reminder, again, is about, because of some of these rules and the restrictions around numbers and how many people can go into a store or into a restaurant at any given time, you need to expect that things will take a little longer. There may be lineups that respect social distance. You may have to, just be a bit more patient as you're moving around, for instance, a store environment. But all this is in place to keep you safe and to keep your fellow Nova Scotians safe. So again, asking people to be patient, to think about others, and how you work together collectively, whatever setting you're in, to keep each other safe. I recognize that it's going to take some time for everybody to learn and adapt to this, but if we're patient with each other, if we work together, we can move ahead and minimize the chance of COVID-19 coming back, while we all work together to respect the necessary public health requirements.
Thank you, Dr. Strang. Chrissy, we'd be happy to take any questions.
And there'll be one question and one follow-up for each reporter in the amount of time that we have for today. First question will go to CTV's Natasha Pace.
Thank you. I wanted to start off, I know, Premier, you were asked about yesterday the proposed class action lawsuit filed against Northwood. I'm wondering, now that you've had a full day to think about this, whether or not, with that and with the growing calls, you will call for an inquiry into the situation at Northwood, or if you can commit to some funding for Northwood to create single rooms for their occupants at their Halifax facility.
We're working with Northwood to continue to make sure we eradicate this virus. Prior to this virus, there had been ongoing conversations around the very thing that you're referring to, which is single rooms in the facility. There was a number of conversations between the Department of Health and Northwood, and they'll still be ongoing. And of course, we'll work with not only Northwood, but all of our partners. You may have noticed we announced 32 beds that we were opening with the Shanix Group. That would be coming online. That's in response to ensuring that we can continue to provide long-term care in the appropriate place.
Natasha, do you have a follow-up?
I do. I guess this would be for the Premier or for Dr. Strang. Since mid-March, the QE2 has run over 700 COVID tests for PEI and over 400 for St. Pierre Miquelon. I'm wondering, why are we running tests for other jurisdictions, and how does that affect capacity here, and who pays for that?
I can. As far as I'm aware, it's a cost recovery payment, but we're doing it certainly for St. Pierre Miquelon. They do not have their own lab capacity. The numbers from there are over. If you look at that, you've given a total number, but over time, it's not had a substantive impact on our lab capacity. We did some tests for PEI for a period of time. They were having some challenges within their laboratory, so as good neighbors, we stepped in and supported them in that. Again, we were through the good work of our lab colleagues led by Dr. Hatchett. We have robust capacity in our labs. Certainly, we would not have done things that jeopardized the ability to do testing for Nova Scotians. But at the same time, we're certainly willing to help out if we have the ability to help out our neighbors to support them in their testing.
And we were grateful to be able to be part of that opportunity. That's exactly what Canadians, particularly Atlantic Canadians, should do, is respond to the call of a neighbor when they need our help. That's what we do every day with our own individual neighbors, and Prince Edward Island needed our support early on, and we were very happy to be able to support with them. And I want to say, from the very beginning of this, the calls with my Atlantic counterparts has always been focused on how can we best support our collective citizens. We continue to do that, and we will continue to do it after we see things open up when it comes to PPE, looking at the manufacturing capabilities of Atlantic Canadian firms who've stepped up, many of whom have contracts with the national government. Is there a way for us as a region to continue to build that manufacturing capacity, create some jobs, at the same time ensuring that we have PPE for any future outbreaks? So I want to thank my colleagues here in Atlantic Canada for their level of collaboration that they've shown throughout this whole ordeal.
Next question will go to Global's Alicia Draus.
Thank you. Just following up again on the class action lawsuit, there is a possibility that the province could be added to the list of defendants, and I'm just wondering if the province is prepared for this possibility.
I haven't been involved or following what took place around the class action lawsuit. Quite frankly, the lawyers will deal with that. My job is to focus on the public health of Nova Scotians, continue to build towards the economy reopening. That's what I've been focused on, and we'll continue to focus on that. Friday's a big day for Nova Scotians, and we want to continue to make sure that we're answering those questions at the same time, focusing and continuing to remind Nova Scotians that to follow the public health protocols, because COVID is still here. Even though the numbers are low, COVID is still here, and it's critical that we follow those protocols to help flatten the curve and mitigate any spread that may happen.
Alicia, do you have a follow-up?
I do, yeah. Just talking about reopening, I'm just wondering, with just being days away, are there any sectors that still have not submitted their plans for reopening that are required to? And if not, is there any way that they will be able to open come Friday?
No, every sector that was closed down under the order have plans in. Not all of them have had final approval. They all come into either the regulated health professions come into my colleagues in the Department of Health and Wellness. All other businesses going first through labor and advanced education, occupational health and safety. So there's a few that are in the final stages, and I know I've got a number of emails of plans that I have to approve later today. But we're in a place that everybody has plans, at least somewhere in the process. The majority have already been sent back as approved.
Next question will go to...
Before you do that, I want to go back. Natasha asked me a question earlier around long-term care. Natasha, I said 32 beds, which it's actually 23. So I apologize. We opened 23 beds, and we've also reached out to our other long-term care partners to see what their capacity is.
Thanks, Premier. Next question will go to Stuart Peddle with the Chronicle Herald.
Thank you. My colleagues at Saltwire have been crunching some numbers and looking at the overall curve of Nova Scotia compared to Newfoundland and Labrador. There was a peak, I guess, in Nova Scotia around April 23rd, where we had 55 positive cases. And then it kind of drops off precipitously until we are currently where we are, with a couple of days of 0 and now a couple of days of 1. Newfoundland and Labrador had a peak way back in March of 32 in one day, and then they dropped off near to zero, but they're still showing the occasional case. There was, I think most recently 3. And so I was wondering how you can compare the two provinces as far as how the curve is flattened in Newfoundland but still is showing cases, and whether in Nova Scotia our cases went down so quickly from such a high peak. Is there any kind of thoughts to that?
I mean, what you look at our epidemic curve, I mean, it's quite typical of it matches actually quite closely the curve we see every year of a 6 to 8 week period with influenza, a very sharp increase and several weeks of high activity, then a fairly rapid drop off. So the curve actually looked very typical to me. We certainly fully expect that as we get to the tail end, we're going to still have these sporadic cases, and like Newfoundland is having. Our goal is not to have 0 cases. That's an ideal, but we know that we're going to have some occasional cases. We may actually get some more cases as we reopen things, but our objective is to actually maintain a strong surveillance and have the ability to act very quickly, identify those cases through robust testing, and then have good public health follow-up. And so we minimize the chance for the 1 case to become 10 cases, and also being very, very careful of looking for signs of any outbreaks. So we need to continue to maintain strong surveillance, laboratory testing, the 811 and the NSHA assessment process, and rapid follow-up by public health, so we can move very quickly, fully expecting we're going to have some sporadic cases as we move forward. Again, this is not about having no COVID, it's about controlling COVID while we necessarily open things up, and having the two go hand in hand, all based on a very strong surveillance program.
Stuart, do you have a follow-up?
I do, related around the opening of things coming up in the weekend. I know in the past some Nova Scotians have tended not to follow the strict guidelines. We saw some people rushing out to beaches and things. I'm hoping, or are you hoping that they take the message of being cautious in their approach as the things open up, because people, I'm sure, are just dying to get out there?
I fully understand that the people have been kind of isolated, but we have been able to open things up robustly in a number of ways in the outdoors, which has helped. But we would ask, I think the vast majority of Nova Scotians understand their need to continue to be cautious while we open things up, respecting, as I went through, expecting the public health requirements as we get out more into social settings, out more as we open up retail spaces and bring people back to work. I think the majority of Nova Scotians understands and have an expectation of each other and the people that are running those various settings working together to maintain safety.
Next question will go to Preston Mulligan with CBC.
Hi, thanks. My first question is for Dr. Strang, and the Premier can jump in when he's done if he wishes. I'm wondering about how you're weighing whether schools, public schools, P-12, resume in the fall. What kind of markers will you be looking for, like epidemiological data, will you be looking for that will help you decide whether it's a good idea to send students back to class in September?
So we haven't started a conversation yet about public schools. It's coming very soon. I know we've got some meetings coming up in the next couple of weeks, understanding that we're very busy focusing on getting to Friday, and then we're focusing on working on our daycares who are coming soon. But so we haven't had a detailed conversation yet about schools, but we need to get there.
Preston, do you have a follow-up?
Sure. My next question is for the Premier about Northwood. I know you said you deal with the future of Northwood when this outbreak is over, but I'm just wondering what your vision is right now. So if Northwood eventually moves to private rooms, will the funding for Northwood still be on a per-bed basis? In other words, if Northwood moves from, say, 400 beds to 250 beds, will its funding decrease, or do you want it to stay the same?
Those are conversations that we'll continue with Northwood. Obviously, as the administrator of that facility, there's certain costs associated with it. What does that look like? But we'll get an understanding of how do we ensure that we provide the appropriate level of care in the right places. I mean, obviously, this virus, when it get in through people carrying it who were asymptomatic, not realizing they were carrying it, get in to this facility, had a huge impact on families and quite frankly, the province. So we'll assess that and we'll look at that. And then when we make decisions around what does the bed configuration look like, the funding model will reflect that.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Dr. Strang, given your understanding of how a second wave of COVID might hit Nova Scotia, what's the likelihood that you would recommend postponing municipal elections? And what type of increases in cases or change would lead you to make that decision?
So like my answer I just gave now on the schools, and I sort of answered this the other day, we've been asked to engage with Elections Nova Scotia. I've asked to push that off for a couple of weeks. We have more urgent things, but we will be looking for a conversation around elections coming soon. A lot of those conversations will lay out some principles, and then we're going to have to say, well, what does as we've opened up, what are the next few weeks and into the summer months, what do they actually look like? And we need to have that where we can start to talk about some public health principles about how we run elections or schools, whatever it is, in a safe manner. But you have to actually allow some time for the epidemiology to evolve before you make final decisions.
Lindsay, do you have a follow-up?
Yes, thank you. As we reopen, are you thinking about adjusting the government communications plan? Do you plan to stay at 3 press conferences a week or scale back?
We'll look at that as we go forward. Obviously, we'll reduce those as we start seeing things happening, but don't know the exact formula or when that will happen. When Dr. Strang and I have always had commitment that even with 3 weeks of 3 a week, if something were to happen, we would be back here to communicate to Nova Scotians, and we'll continue to do that. But we'll give Nova Scotians plenty of notice if there's a change in the way we communicate to them.
Next question will go to Katie Hartai with News 95.7.
Some employees are refusing to go back to work now that they're earning more on CERB. How are small businesses supposed to deal with this?
This has been one of the challenges that we've heard really across the region, and we've communicated that to the national government. It has certainly been challenging that when people are receiving more income to stay home than come to work, people are making that choice to stay home. We'll see our way through this. I strongly encourage all Nova Scotians to take the opportunity to go back to work. While it may have a short-term impact, your hard work and effort in the businesses that you are working will determine about the long-term future of that business and, quite frankly, your long-term employment. Let's not look about this in the short term. Let's look about this in the long term. And every business needs its employees to come back to work to help with the viability. And that means that that business will be there for years to come, not just for the next few months when we know that CERB program is going to run out.
Katie, do you have a follow-up?
Yes, please. While I have the opportunity, the federal government has transferred the land it owns at Owl's Head to Environment and Climate Change Canada for conservation. The province did have intentions to buy that land with the purpose of selling it. Does this at all change Nova Scotia's deal to sell the land it currently owns to a developer?
That has not been before me in a while. I can tell you that we're looking for economic activity in our province. We've been a government of strong environmental stewardship. I can list you a number of things that we as a province have done in order to deal with the legacies of governments who've ignored environmental challenges. At the same time, continue to protecting land as we strike the balance of economic development, and we will continue to be good environmental stewards at the same time as good stewards of the economy.
Next question will go to Bill Martin with 6 Rivers News.
Thank you. Once again, today's new case is travel-related. We've seen the outbreak in New Brunswick is travel-related. As we go forward, Dr. Strang, would you be considering some extra strong measures relative to travel?
So I think we have a good measure in place in terms of the requirement for anybody coming into the province has to undergo 14 days of isolation, and that 14 days is the single most important way that we make sure that people aren't out and about in our communities while they're infectious with COVID-19. And so we continue to have both conversations from an Atlantic perspective, and certainly when I'm at the national table and the public health folks around how we approach our interprovincial borders. Everybody recognizes the importance of as we do things within our own province, that we need to be able to make sure that we're doing whatever we can to minimize the importation of COVID-19 back into our province.
Bill, do you have a follow-up?
Yes, thank you. Again, Dr. Strang, the issue is so acute that while Nova Scotians might indeed be abiding by the statutes and regulations that you establish, the New Brunswick experience points out that somebody who really should have known apparently didn't follow the guidelines, and that's the danger we have. And that's why I ask again the question about whether or not there'd be some follow-up strengthening for those who do travel.
I mean, we continue to look at. We have, all the evidence we have is that people who have required to self-isolate have by and large done that, and we haven't seen cases of people of COVID-19 resulting from people not adhering to that isolation. So we'll continue to look at moving forward what is the right thing we need to do around our borders. But I think what we have in place has clearly shown that it's worked.
Bill, I think the two cases you highlight demonstrate why we need to follow public health advice. Clearly in New Brunswick, someone went back into very high populated businesses or activity of vulnerable populations. That's why we ask you to follow public health advice and separate, come home, self-isolate. If you have the virus, we can then deal with it without it spreading across the community. But you're highlighting something that governments are going to have to grapple with. COVID is here. COVID is not going away, even if we flatten this curve. How do we live with it? How do we reduce the risk of spreading it? Those are all going to be ongoing conversations that we have to have. But we still, as an economy, we still have to figure out ways to get economic activity happening, which will include some travel, at the same time making sure that we're protecting the population and not putting them at risk.
Next question will go to Kyle Shaw with the Coast.
Thanks, Chrissy. Dr. Strang, it's been a couple weeks since I asked you about the project to show the number of current active cases on the province's COVID map instead of just the total number of cumulative cases. And you've been making good progress on this. You got the case backlog of data taken care of. And, it's now understood that the one-day timing lag between the long-term care numbers and the rest of the numbers is something we'll just have to deal with. So when you and I last talked, you said discussions were ongoing with the privacy folks. So can you give an update on where that project is?
So we've looked at that. I mean, we've looked at that, and really the conclusion we've come to is that the numbers are now so low that there's really nothing to add. Our total number of cases is what we'll continue to have up by health zone.
Kyle, do you have a follow-up?
Yeah. So why won't you be doing the active cases? Because that's a very key thing, as well as the total number of cases.
We really know that our total number of active cases is essentially zero. So we've really conclusion that there's nothing really robustly to add. We'll look at that. If we get more activity, then we might change that. But at this point in time, we really felt that in terms of all the things we need to do, putting more energy and effort into that was not something we felt was a value add enough for Nova Scotians to move forward on that project.
And that's all the reporters we have on the line for questions today. Go ahead, Premier.
Thank you, Chrissy. I had a very rainy walk to work today, even though I didn't have an umbrella, which was probably a good thing. It was tough on my hair, but it gave me an opportunity to see the activity that is taking place in our city and watch people getting ready for the reopening of our businesses and watching restaurants begin to put their patios out and doors to open. I want to congratulate those restaurants and breweries and wine stores who came up with a new takeout and delivery model during COVID. You adapted in order to stay open, and that forced us as a government to adapt with you. That's why we changed our rules to give you the flexibility to deliver alcohol during the pandemic. It's gone well, and it's worked for your business model. So I want to let you know you can keep doing that if you want. I also noticed lights on in other businesses that were in the dark. I know a lot of you have already made hair appointments. Businesses are preparing, and that's a good thing. And I know many of you are nervous, but we have to get our economy moving again. We are taking it slow, we are reducing capacity, and protocols will be in place, and we need everyone to follow them. And I believe we all understand the importance of self-distancing and wearing a mask. Many of you still have questions. To those businesses forced to close, I hope you've been in touch with your associations. If you weren't forced to close by Dr. Strang's order but did anyway, the information for you is on our website, Reopen Nova Scotia. The bottom line for all of us, follow the protocols and be safe. The protocols are also available on our website, and we are 2 days away from reopening, and Dr. Strang and I are feeling very positive about where we are. But I want to reassure everyone, testing will continue, and if we see any sign of a problem or a case spike, we will take immediate action. I'm really proud of all Nova Scotians. We are not out of the woods by any stretch. We need to continue to be patient, to care for one another, even if it's from a distance. And what's really important is that for all of you to support your local businesses. They need you and they want to welcome you back. So think local, buy local, support local. That makes us, Nova Scotia, strong and Nova Scotia proud.